the other day, I told you that there was some studies been done, some research regarding fibromyalgia and a direct link with the thyroid and hypothyroidism. Well, anyway, I thought I'd just read you the abstract to it, and it's quite interesting. So, if I remember, I'll leave a link in the description on the actual at the bottom of this video. So let me just read it to you. I'll try my best without losing my voice. All right, you know how it is with fibro. So, okay, and it's in PubMed. It's the National Library of Medicine, yeah, and it's a metabolic basis for fibromyalgia and its related disorders. The possible role of resistance to the thyroid hormone, hypothyroidism. So this is the abstract, right, of the thing. It's quite a long study. It has long been recognised that the symptom complex of fibromyalgia can be seen as hypothyroidism, and hypothyroidism may be categorised like diabetes into type 1, hormone deficient, type 2, hormone resistant. And most cases of fibromyalgia fall into the latter category. The syndrome is reversible with treatment and is usually of late onset. It is likely more often acquired than due to mutated receptors. Now that there is evidence to support the hypothesis, I got the range of my voice, sorry, and that's because of fibro. That fibromyalgia may be due to thyroid hormone resistance. 4 major questions appear addressable. First, can a simple biomarker be found to help diagnose fibromyalgia? Second, what other syndromes similar to fibromyalgia may share a thyroid-resistant nature? That is interesting. Third, in non-genetic cases, so people weren't born with it basically, how is resistance acquired? How have we got this? How did we catch it? It's not bird flu, I know, but you know, how did we get it? What was the trigger? You know, what? I haven't had this all my life, as far as I know, anyway. So anyway, how is resistance acquired? Acquired. And fourth, what other methods of treatment have become available through this new understanding? Preliminary evidence suggests that a serum of hyaluronic acid is a simple, inexpensive, sensitive and specific test that identifies fibromyalgia. So it looks like they've already got a possible test for fibromyalgia. Now, the overlapping symptom complexes suggest that chronic fatigue syndrome, which isn't fibromyalgia, and Gulf War syndrome, premenstrual syndrome, and post-traumatic stress disorder, breast implant silicone sensitivity syndrome, I ain't got that worry, got my own breasts, and bipolar affective disorder, systemic candidiasis, myofascial pain syndrome, and idiopathic environmental intolerance are similar enough to fibromyalgia to merit investigation for possible thyroid resistance. This is getting really interesting. If you've got hypothyroidism and fibromyalgia, this could actually answer a lot of questions. Now, acquired resistance may be due most often to a recently recognised chronic consumption coagulopathy, oh God's sake, apathy, which itself may be most often associated with chronic infections and mycoplasmids and the related microbes or parasites. Other precipitants of thyroid resistance may use this or other paths as well, In addition to experimentally proven treatment with supraphysiologic doses of thyroid hormone, which I suppose that's what I'm taking at the moment, thyroxine, and thyroid-resistant disorders may be treatable with hypercoagulant, anti-infective, insulin sensitizing, and hyaluronolytic, oh crikey, strategies. Somebody's going to know better. I'll leave it in the description. I better make sure I remember to do that, because it's, for someone with fibromyalgia, this is actually really interesting. And this is just a breakdown of the compact version of the condition. Of the study itself about the condition. What they found. This was in PubMed, Advanced User Guide. Anyway, National Library of Medicine. And this is an American site. Yeah, so it's quite interesting. This isn't new. This was done some while back in 2003. You know, by R.L. Garrison. So it's quite old. It'd be quite nice to see some movement on this, wouldn't it? Or maybe there has been and they haven't got any further. But it's quite interesting. And there's some more articles on here as well. Some older, some more recent. So yeah, fibromyalgia, infection and vaccination. So there's lots of things that, you know, that don't seem to be available to us or not mentioned. But it's has been looked into. What do you reckon? Yeah, please leave it in the comments down below. But please people like button and maybe subscribe to the channel. And then the way around. So then you know, don't forget the bell icon. Yeah, because then every time I upload another video, you'll get a warm fuzzy feeling in your pocket. Yeah. Oh, nice, eh? Toodaloo.